Here are 4 over-the-counter supplements that can increase your risk of bleeding. Number 1, fish oil. Fish oil is also known as omega-3 fatty acids, and it's a supplement commonly taken for anti-inflammatory and triglyceride-lowering properties. When taken in larger doses of 3 grams or more, thinning of the blood has been observed. And you may be thinking, well, Dominique, I don't ever take that much fish oil, so I'm good. Well, that may be true, but here's another fun fact. Most people taking fish oil to lower their triglycerides are actually underdosing. To see an effect on triglycerides, you should be taking about 4 grams per day, which is also where we see those blood thinning properties observed. Number 2, niacin. Niacin is a form of vitamin B3, and daily doses of 500 milligrams or more can help improve cholesterol levels, such as the lowering of triglycerides. This bad boy has also been associated with slowing down the process of blood clotting. Number 3 is fenugreek. Fenugreek is a herb native to the Mediterranean region, Southern Europe, and Western Asia. In women, it's primarily taken to help regulate menstrual cycles, reduce menstrual cramps, menopausal symptoms, and also increase natural curves. For men and women, it can naturally increase libido. Number 4, Saw Palmetto. Saw Palmetto is a supplement that helps to treat symptoms of enlarged prostate and reverse male pattern baldness. Well, at least that's what people are taking it for, because unfortunately the evidence is not evidencing. And because it's a supplement, like all supplements, results may vary. I actually personally took the supplement myself for a few months to try to help regrow my hair after I experienced a significant hair loss phase after some shifting of hormones. And what I do know is it caused my platelets to drop below normal. I can explain what platelets are at the end of this video for those who you really want to know. It's relevant to the blood thinning process. But despite that, you're probably wondering, well, Dominique, did it work for your hair? And unfortunately, I cannot say. I was taking a ton of hair growth supplements at the time, so it's hard for me to pinpoint what actually helped. But I do know for a fact it caused my platelets to drop. So these aren't the only 4 supplements that are available that can increase your risk of bleeding. Personally, I've used 3 out of 4, and I chose these 3 because not only am I familiar with them, but also because they're commonly seen in blogs for people to take to enhance their health. But the take-home message is that herbs and supplements are not completely harmless just because they're natural, especially when people don't know how to use them. They're taking unsafe dosages or they're taking untherapeutic dosages. So we need to keep this in mind, and not to be a pharmacist, but I do want you to talk to your providers before you start herbs and supplements. For example, if we took one of these supplements while we're on aspirin, ibuprofen, warfarin, or Eliquis, this will further increase that baseline risk of bruising and bleeding. So I need you to talk to your doctors, especially if you were on other medications, have baseline medical conditions, and or if you were 65 years or older. For my curious minds who are still watching this video, here's the bonus info that I promised. How are these supplements increasing the risk of blood thinning? Well, most of these supplements have what we call anti-platelet activity. Platelets are these small cell fragments in our blood that work to stop or prevent bleeding when a blood vessel gets damaged, i.e. they make sure that we don't bleed out all over the place when we get things such as a minor paper cut. We call agents like these antiplatelets because they have antiplatelet activity, and we're inhibiting the amount of platelets that are produced, or we're reducing their ability to clump together to form a clot. In certain instances, we really do want this, like those who have a history of heart attacks or strokes, to prevent a secondary event. But someone who doesn't have a medical requirement to delay clot formation, it's not ideal to suppress our body's natural ability to form a clot, because this is a protective mechanism in place to prevent us from uncontrollable bleeding. If you learned something new here, like, comment, share this post. Thank you for being open to learning something new. Stay blessed and stay curious. I'm out.